Dr. Ken here with the Schizophrenia Care Project. Today, I would like to talk about fear from three important perspectives. The prelude here is that there are both realistic and unrealistic fears. Let's talk about the realistic ones. First, the fear experienced by your loved one who is living with schizophrenia. Second, your concern that they may act in ways that could harm themselves. And third, your understandable worry that during periods of severe symptoms that they may act in ways that could endanger others. Understanding these different forms of fear can help us to respond with wisdom rather than with panic. For many people living with schizophrenia, fear is very real. Delusions, fixed false beliefs, and hallucinations, which are positive symptoms, so called, they can create an inner world which feels completely convincing. This is different than the unrealistic fears of other folks who may be concerned about their boss firing them when that's not a real thing. Voices may threaten them or warn them or tell them frightening things. That individual may believe that someone is trying to harm him or her, or that terrible events are about to occur. While these experiences may not match objective reality, the emotions they create are genuine. The fear is real, even when the belief is due to psychosis. Sometimes these frightening experiences can lead to despair. A person who feels trapped by terrifying voices may be trapped with overwhelming hopelessness. They may begin to believe there is no way forward. This is why we take thoughts of self-harm or suicide very seriously. Fortunately, there are many protective seat belts that we can put in place. Antipsychotic medications are the mainstay. They are the foundation of treatment. Cognitive behavioral therapy, supportive counseling, peer support groups, lifestyle medicine, lifestyle psychiatry, a nurturing, safe home, all of these work together to reduce risk and to restore hope. Families also carry their own burden of fear. You may worry that your loved one could become frightened enough by his or her own paranoid thoughts that they attempt to defend themselves against imaginary danger. For instance, in my years working as a hospital psychiatrist, I occasionally encountered patients who mistakenly believed that I intended to harm them. What helped most was not arguing with their beliefs, but responding calmly, reassuring them of their safety, and maintaining a respectful, compassionate presence. Often kindness succeeded where confrontation would have failed. Please remember that the vast majority of folks living with schizophrenia are not violent to others. Most are struggling with fear, confusion, emotional pain, rather than aggression. When families understand this, they are better able to respond with empathy, while also taking sensible safety precautions when warning signs appear. One of the greatest gifts you can offer your loved one is a home where trust can grow, a calm environment, predictable routines, respectful communication, appropriate medical care, and emotional support become powerful tools for healing. Recovery is rarely a straight line, but every act of patience strengthens those family relationships. Fear loses much of its power when it is met with knowledge, compassion, and hope. As caregivers, we cannot eliminate every challenge, but we can create conditions where safety, dignity, and recovery become far more likely. Together, we can move towards balanced, healthful, meaningful, and respectful lives for every member of the family.